At Solihull and West Birmingham Hospitals Trust we have an organ donation committee, and part of our work is to raise awareness amongst the communities about organ donation. At the moment we have 7,000 people on the waiting list, and just under 30% of those are from the Black and Asian minority ethnic groups. We know that these people are more likely to need a transplant because they're susceptible to diseases such as hypertension and diabetes. However, currently we know that just over 60% of families, when approached about organ donation, say yes. We were able to film 5 TV shows with Sangat TV as we had links through the Sikh chaplain at the Solihull and West Birmingham Hospitals Trust, and these shows were aired nationally and internationally. We've also recently had the unveiling of a memorial at City Hospital, which we had local engagement from the press and media. It's very difficult to assess exactly what success we have. With the unveiling of the memorial that was attended by local press and media, and with the TV shows going out nationally and internationally, we know that our message is getting out into the communities to raise awareness. We've also been able to forge links with the Asian Rationalist Society, and they've done a lot of work for us on our behalf, speaking to the Black and Asian minority ethnic groups, and they've been able to get people to sign the organ donor register, which they've very proudly presented to us at Solihull and West Birmingham Hospital Trust, so that we know that our message is getting out there to those people. We would be delighted at Solihull and West Birmingham Hospitals to win this award. The Organ Donation Committee will be extremely delighted, and it will motivate us to carry on doing the work that we do.
The stigma within mental health services is our biggest challenge as a trust. We look after 56,000 patients across Birmingham and Solihull, and how we try and engage with the community is really important. So we came up with the idea of having a family fun day on specific sites where there's known to be stigma in the local areas.
Very positive impact for the last 4 years that we've been working with the project. We've had financial gains from the project with the hospital being so open and people being able to contribute to us improving our activities and the resources we have, and also being able to provide engagement for other cultural events throughout the year. The patients we involve throughout the whole process, it's very much led by them in terms of decorations and the opportunity for them to produce crafts and art and music that they'd like to be showing on the day. And there's no other intervention really that we can offer that gives patients the role and enthusiasm and the opportunity to be so involved.
We're now seeing businesses support us. We're now seeing local community, whether they be shopkeepers or whether it be just local residents, come along. Community members who definitely had a poor perception of mental health services are coming and visiting, and also making financial contributions to the project, which we couldn't have dreamed of at the beginning. To win the award would suggest that we could raise more awareness not only within Birmingham but within other regions. I think it's a really good example of how to engage with mental health patients.
We know that mental health problems are very, very common, but the majority of people don't know how to respond or even how to provide comfort to somebody experiencing mental health issues in the community, and professional help isn't always available. The mental health first aid training doesn't teach people to become therapists or mental health workers, but it really develops their knowledge and understanding and increases their personal confidence in being able to do their very best to support somebody in distress and hopefully to prevent the problem from becoming worse.
As someone that's actually taken part in the training, I found it a safe and friendly environment where people could come together from different backgrounds and just discuss openly the issues about mental health and actually combat the stereotypes attached to it as well. I personally felt that in the 2 days of the training I learned a lot about mental health as an issue, but I also felt empowered about what I could do as a person to help other people that would be going through a mental health illness.
We set out to train 100 people in 6 months, but the demand was so great we actually trained 130 and continue to train people. The training has been accessed by police officers, probation officers, social workers, faith groups, carers, service users themselves, and that clearly demonstrates that the training is relevant for everybody and highly valued.
The work and the changes that we've seen in the people has made a significant impact on their lives, and to be appreciated for our work and how it's impacted on our community would just be a great thing to be appreciated for.